Hello, and
Hello.
welcome to the OpenMRS Community Spotlight. My name is Glen McCallum, and I'm here today with Jonathan Galingan,
Yes.
Galingan, and he is, I'm assuming you work at the National Telehealth Centre at the University of the Philippines in Manila. And from what I've read on the internet, I believe you're a recent graduate from medical school as well.
Yes, sir.
What is your role at the National Telehealth Centre?
I used to be a project manager for an implementation of OpenMRS in two hospitals in Capital as part of a study in knowing the cost-benefit analysis of computerization.
Wow, is this part of your graduate studies or your schoolwork, or is this more of a
Uh,
job?
More for job.
Are you still doing this? Are you still in this role?
Right now, the project is down to data gathering,
Oh,
and
okay.
that's it. So basically, I'm out of the picture because the implementation has already been done.
Oh, okay. I'm going to ask you some more details about that in a few minutes, but let's back up a little bit in time. When did you first hear about OpenMRS?
OpenMRS when I was hired by the National Telehealth Centre on February of this year.
Okay. And what had they been doing with OpenMRS up until that point when they hired you?
Um, when they hired me, we were still in the process of picking good software to be implemented in these hospitals. And when I already entered the National Telehealth Center, OpenMRS was already picked, and we were already studying how to implement it in the hospital.
Do you know what other systems they had considered as part of their evaluation?
I'm not sure. I was just given that OpenMRS was the program of choice.
Oh,
So,
okay.
but I was given the reasons behind.
How many people are on your implementation team?
Um, how many were? One, six. We were six. Three encoders, one telehealth nurse, and my mentor, which used to be the project manager.
Oh, okay. So I remember there are some programmers that you have at the National Telehealth Center, aren't there?
Yeah. Oh yeah. There are. Oh yeah. I forgot the programmers. There's one developer that was helping with OpenMRI.
So were you doing some custom development or some module development on OpenMRS to prepare it for these hospitals?
Um, we tweaked the form printing module a bit because it wasn't printing very well when we got a hold of the program. So we had to modify the form printing module.
Anything else that the programmers are working on, or were they doing deployment and systems engineering support as well?
Right now, we are developing a module for our a sort of national insurance system, so that we could link with our insurance system called PhilHealth.
Oh, wow. So that's a major effort to support the financials with OpenMRS.
Yes, but we are still in the process. It's not just perfected. Still being under development. Still under development.
That's exciting. So two hospital sites. How big are these hospitals?
I'm not sure, but we get approximately less than 1,000 patients coming in every day, and less than 100 bed capacity.
Oh, okay.
Or 40. And I'm not sure of the actual numbers. I think it's an estimate when I was there. I think it's less than 100. Less than 100.
And what kind of care do these hospitals offer? What kind of
Um,
services?
they could offer major surgeries. Um, they are considered as not sure of. I think secondary hospitals. They're really considered as secondary hospitals, a tertiary hospital. They have only one tertiary hospital in that province so far.
Very neat. So,
Yes.
so how many users are there of OpenMRS in these settings?
Settings we have four workstations, one for the lab, one for the emergency room, and two for the outpatient department.
And what function are they using OpenMRS for right now?
The OPD workstations and the emergency room workstations. Yes, it's for patient registry, and the labs department is to input lab info about the
So for lab results,
lab results alone.
are any clinicians logging in to view lab results for the system?
Yes, clinicians can log in to view the results of the system. Can, but it depends really if the doctor wants to log into to see this information.
Hmm. What is the subject of the research study that you're using OpenMRS for, that you were hired for?
I was supposed to check if there are the costs, mainly the paper costs, if they were decreased. What else? Basically costs. What were the costings for installing the electricity, everything, all basically on costs, on paper costs that were saved.
Wow.
Uh,
I know you're still in the data gathering stage. Are there any preliminary results you're noticing?
I did not do the analysis basically, but I can't see. I can't generalize for now because I didn't do any statistical analysis of it. Okay. I think if there are benefits, it's not that profound, so that I could generalize. If I could not see the results aren't profound.
I noticed when I was looking on the OpenMRS wiki some of your train the trainer materials. Can you tell us a little bit about your implementation approach in terms of training the trainer and getting things up and running?
Basically, with our training, we have it's more of like an introduction to OpenMRS, so that if people would like to use the OpenMRS in their facility, they would know what it can do. Yeah, what more of what it is capable of doing, how it can
So
accommodate their forms.
this
And
sounds like it's separate from your research project. Is this more to do with education and engagement at the Telehealth Centre?
yes, more of education, more of probably an increasing awareness and advocacy to open source software. That was the purpose of the trainings and seminars.
Do you just do it at the university, or do you do it as you travel around the country and to different places?
No, just in the university. Yeah, in the university.
Is it for students or professionals?
Basically anybody that wishes to avail of the knowledge. So students, professionals, IT personnel,
Yeah,
they avail of the
I've
training.
seen some of the other ones about configuring the systems as well. You have I noticed one on creating forms in OpenMRS as well.
Yes, sir.
Have any of these professionals that have come to your education sessions gone and implemented OpenMRS in a different setting, in a different site?
They are planning still. They are planning, but haven't implemented per se.
What types of sites are looking into it? Physicians' offices or different community health facilities?
The ones that I've trained are nursing schools. They wanted to put up an OpenMRS server just to train nurses on how OpenMRS, how to deal with electronic medical records. And another group that I've talked with wanted to create a company that brings that implements open source software in different institutions.
Hmm. Do you
Basically,
know of
they
any?
have
I was going to
or
say, go ahead.
yes, sir. And then no, you first, sir. Okay.
I'm just wondering if you knew of any other sites in Asia that are using OpenMRS and are live like you.
No, I haven't. Heard of another one implementing OpenMRS. I tried to look up Batangas State University, and I haven't contacted them. I wasn't able to contact them.
Thank you.
Like,
Who trained you on OpenMRS?
my mentor, Dr. Arthur Manson. Yeah, he was the one supposed to be the project manager of the implementation, but he needed to leave for Canada, so he trained me before left.
Hmm. So who trained him? Do you know, or he learned about OpenMRS?
I think it's this a hearsay, but I think him and our developer learned it on their own.
Hmm. Interesting.
From the documentations.
So what are you hearing from users about OpenMRS? What do they like about it?
Are you sure? The ones I implemented it on.
Mm-hmm.
Basically, they don't have any EMR to compare with, so they have the usual. What they like about it is the easy query of patient numbers, because we only implemented it with in terms of patient registry and lab results in labs. So what they like about it is that it's easier to query um, patient data. That's one thing that they really like about it.
Are you hearing any suggestions from improvement from them?
The director of the hospital kept bugging me on billing support, on billing, basically
Mm-hmm.
on money matters. The cost, on if OpenMRS could accommodate that. That was the main concern.
How supportive has the hospital administrator and hospital administration been of adopting open source software?
They were very supportive because our, as I told you, the PhilHealth insurance policy, our national insurance company, made their policies much strict. They became more strict in their policies, and they wanted uh, one identifier per patient. They have a one identifier per patient rule. Okay, so And what happened before is that since there are two, two, two sites where patients are being registered, hospitals in where I implemented OpenMRS had two identifiers, one for the emergency room and one for the outpatient department. So the only way to unify them was to use electronic medical record system, which made that director of the hospital very compliant with using OpenMRS.
So those two hospitals are each have their own instance of OpenMRS. They're not sharing a server.
Nope.
Interesting.
We have plans of unifying the data, but maybe for later years.
How long does the data gathering phase of your study last?
I think we've already taken all the data needed. It's the analysis and the paperwork that's being done right now.
With the hospitals.
Oh yeah.
Continue.
Yeah, I'm just going to gather more data if the principal investigator plans on modifying the research.
The hospitals plan on continuing with OpenMRS indefinitely.
They have to. If they stop using OpenMRS, they would have. I'm not sure. I think it will be quite a hard time if they discontinue using the system. Because yeah, it will be hard to find their records.
That's all the questions I have for you. I thank you for taking a few minutes to talk with me today. I'd like to contact you later to find out more after the financial component that you're working on is done and gets implemented.
Oh yeah. I mean, we haven't tried modifying OpenMRS. We're not actually developing a module for the finance yet.
Oh, okay.
Actually, one of our plans is to combine OpenMRS with OpenERP. If you're familiar with OpenERP.
Yeah.
Because yeah, we see the administrative functions of a hospital comparable to a large scale enterprise. And I'm not sure if we do it from scratch, we'll be able to cover all the features of a hospital, all the administrative features of a hospital.
So, in the scope of OpenERP and OpenMRS, where would the billing component fall in there?
OpenERP has a billing component, almost billing, inventory, procurement, everything that enterprise needs. So that's what we plan.
Very neat. All right, thanks for sharing that, Jonathan. Thanks again for talking to me, and looking forward to talking with you again.
Okay, thank you, sir.